Wow, it's really great to be here and to look out into the crowd once again. It's been quite a change that we've had over the last year, 2 years, decade, whatever, right? We're going to talk about all the changes that's happened in dentistry, just even recently, but over the last few decades. It was about 2011, I think, if you guys remember, or I'm sorry, it was March 11th, 2020, the day you guys will all remember when the World Health Organization announced that we had a global pandemic. I'm sure you all can remember where you were sitting, and many of the doctors here wondering, wow, what are we going to do? We've got to furlough, lay off our patients. What's all this stuff with this PPE loan that we're getting inundated in our mailboxes? What's going to happen? And while many practices were closed, I too had to pivot and think about, Val, what are you going to do? How are you going to take care of your family? Because my books for the next ever so months went from thriving and being busy and on the road every weekend to nothing. I was sitting at home all alone, wondering, what am I going to do? So thankfully, I'm a hygienist and a very passionate one. I had to roll back and remember, Val, what is it that you love to do most? And why is it that you do what you do? And it was through my passion that I knew that, I had to get back to the chair, because I'm on Facebook and I'm watching all my colleagues flourish. And I'm watching all my dental friends suffer because they were closed for 4 months and they can't even get their employees to come back to work and open their doors and take care of their patients again. So I get a call from one of my colleagues and she says, Val, I need help. Can you help me? My hygienist is not coming back. And I knew then it was time to scrub up and go to work. So I called my good friend Deb Carrier. I'm not sure if she's in this room. But I said, Deb, I need some help. I need some hair caps. The times have changed. I'm going back in. I don't know what's going to happen, but I'm going to look like an alien and I need you to protect me. Right? I was scared. I was scared like many of you hygienists that are watching today or doctors today when you were going back and you did not know what to expect because there was this thing called SARS-CoV-19 in the air and we just did not know how we were going to protect ourselves, let alone protect our families. So we finally go all in. We're wearing all this gear. Those N95 masks, you guys know, because many of you are there with me today still wearing them. We can't breathe, our heart palpitates, we have sweat, we have tears, because our body and our oxygen are not coming together so we can care for our patients, right? We're usually there for our patients to listen, and now we're running in these circles, wondering how we're gonna get through the day because we cannot breathe. We get our patients back, and we see our patients, and they begin to tell us their stories, their problems, their sicknesses in the family, their loved ones that have now passed because of this virus that we've had. So again, we have to put down our shields and our personal pains and our personal things going on in our lives because of this pandemic and say, we're here for you, because that's what we do as healthcare providers. We are here for our patients. We have to put that mental capacity away and be there and show up for our patients. And you guys know, dentistry is hard. It is hard. It is a mental and a physical job, right? The mentality of it, getting through our day, right? Rushing through the operatory and then having to work with our patients and now hearing with them, it's a lot. It's a lot on what it does for us. But thankfully, we have so much technology and we have so much passion in the operatory today that we can get through the days with love for what we do every day in our job. And I'm going to share just a couple technologies that really help shape our operatory, and it's allowed me to continue to love and be passionate in the hygiene chair and what I do every day. First, it starts with the love of lasers. I became a laser hygienist about 17, 18 years ago. I saw what it could do for my patients, and never again do I have patients say, wow, Val, I thought pink in the sink was okay, when we knew it was not okay. We knew that the pink in the sink was an inflammatory infection going through our patients' bodies, and it was causing other types of diseases and links, such as cardiovascular disease, high blood pressure, diabetes, dementia. You guys know all the inflammatory diseases that we hear about, and now we learn, wow, inflammation. We know 9 out of 10 patients were intubated because why? They had periodontal disease. That just changed our world. Now, as a hygienist, we can look deeper as our patients are returning and we're trying to just hurry up and get through our day, but no, now we have to assess. We have to assess our patients because they're coming to us with what? Inflammation. Our patients are coming to us with inflammation, and we have to treat their infection, we have to treat their disease. So we have to do those assessments, not pick up those scalers. Yes, I have a Golden Scaler and I'm very proud of it, but I no longer just pick up a scaler. I don't just do what's on the schedule. If it says EX/PRO and reappoint my patient in 6 months. I take my patient back, I treat them as a healthcare provider I am. You see, I'm a registered dental hygienist, right? That means I can radically change and deliver healthcare for my patients. Through those assessments with vitals, now taking temperatures, we are doing oral cancer screenings that can potentially save a patient's life. We are doing airway assessments, kind of been a big buzzword around the conference this week. And we can change lives, not only for adults, but for children and for families, because it's that child that has been misdiagnosed with ADHD when we come to find out that they had a sleeping breathing disorder, where you're not changing the child's life, you're changing the family's life, because that's a family thing that's going on in that household, right? So beyond those screenings, we also have the assessments for malocclusion. Same thing, we want to look at that airway. We can now use technology that's available to us to scan our patients. We know in as little as a minute and a half how our patients' bite fit, where their anatomy is, if high palate, where their tongue lives. So again, checking those airways, we know that if their occlusion's off, attributing to their TMJ, that scan tells us so much about our patient's bite and how we can rework and remap them so we can get our patients into proper alignment and breathing right. Okay, it also tells us as hygienists the recession that's present. We can now see with 5D technology, we're able to look at those photos, those films, and we're able to look at the tissue, all there with the beauty of a digital scan. With technology, our patients can actually see the x-rays where our artificial intelligence has highlighted the decay before we even look at it. Our patients are able to see what the scan shows, and they're looking going, wow, I'm pretty jacked up. They're self-diagnosing themselves before we even turn and have to have those chairside conversations. It sure makes it a lot easier when we've got that technology at our fingertips and all we have to do is go to our patient and they say, when do we get started? I hear you. I see what you're saying now. Wow, I didn't realize all that was going on. Because me as an oral health hygienist, I was able to take those and connect the dot, not only what we see, but what's going on in here. You know, again, as a registered dental hygienist, we're more than just janitors. We're more than tooth cleaners. So I want all my hygienists that are listening to stop picking up the scaler, flicking, picking, flossing. No more of cleaning the teeth, cleaning the room, cleaning the instruments, cleaning the teeth, cleaning the room, cleaning the instruments, and getting burnt out. That's what's called burnt out. Find out what it is that you want to do in your practice, whether it's being that laser periodontal therapist, whether it's being that advocate for scanning and looking for your patient's malocclusion and having those chairside conversations, whether it's helping have a conversation with mom sitting in the corner crying, telling you about how their child is having issues in school all the time and she just doesn't understand why. And you look down and their tonsils are enlarged, their tongue is enlarged, you hear it in their nose, and you just start asking questions and help change lives. So find that one thing that you love, find it is that you want to do in the 4 walls of your operatory, and I guarantee you, you'll come to work and never will work a day in your life. You'll love what you do, and your career will prolong. Thank you guys so much.